Hey guys, Nurse D Porche here. If you are new to this channel, here we discuss all things nursing, health, and finances. I have a super special guest, Miss Marie Peppers, the Marie Peppers. And so if you haven't seen the video that we did together, I want you guys to check it out right here before you get into this video. But I had the privilege of taking I'm currently in one of Marie's courses. And so I came across some information and I said, let's have a conversation about this. And I think you guys will want to hear about it as well. This is her telehealth nursing triage course. And I will put it in the description of this video where you guys can access this course. But within this course, I came across some information of independent telehealth nursing. And so we're going to get a little bit into that and what it is, why it's important, and how you guys can possibly start your own business as a telehealth triage nurse. So Marie, without further ado, go ahead and introduce yourself.
Hey.
Tell us something super exciting that you're working on right now.
Well, it's been really exciting these past 6 years, but right now I am working on starting to hire nurse practitioners and physicians. I'm part of the Patients First Foundation, and we have many different businesses that are going to come in underneath the Patients First Foundation. And one of them is that we are opening in 40 states, we're opening primary care virtual concierge services. So
Wow.
That's what's going on right now. And doesn't really have much to do with what we're talking about today, the telehealth nurse, but it's pretty exciting. Because right now, we're going to be having this primary care service, but we're going to have a 360 degree. We don't want to just be the call up because you have a headache or your leg hurts or you've got chest pain and do I see the doctor? Do I go to the ER? We don't want to be that kind of a service. We want to take care of the patient 360 degrees, but we'll be doing this virtually. Eventually, after about 4 months, once we get our prime people in place, 4 or 5 months, I'll possibly be hiring RNs that are not nurse practitioners, few here and there. Eventually, we're hoping to cover all 50 states. For LPNs and RNs, we are going to have our own remote patient monitoring and digital health care. So down the road, which might be 6 or 8 months from now, we're designing our own digital health care. Probably 80% of the remote patient monitoring people are going to be LPNs, and then we'll have 20% RNs. I mean, it's just so amazing. And I'm vice president of clinical services for this company. There are 9 board members. I'm one of them. And there are many physicians, really amazing people that I'm going to be working with. And so we're the foundation, and then we need to get our anchor people hired from all over the country. Also, another thing I'm working on, cardiologists that made a healthcare app that health, wellness, weight loss, EKG, cardiac, the whole bit. So he has the special app that's a program that people can purchase, or it's most likely going to be rolled into some of the programs that I'm working with the other companies. And this app is helping patients to stay on course. It's going to be set up with their Apple Watch and all the EHR, the doctors, their blood pressure monitor, how many steps they take, everything. So that program that I'm working on, that I've known some of these people for a long time, and this cardiologist is from Kaiser. I'm the ambassador for their product, but I'm also going to have 15 of my nurses. And so I got that going on along the way. But my main focus is my courses. I will never leave my courses. Awesome. This is my main thing.
How would you describe telehealth triage nursing to someone who has absolutely no idea what that is?
It can be a little of everything. We have an RN program. It's only RN because the Schmidt and Thompson software people, who are the national ones that everybody goes by their parameters and what they've written. So that program and that software for remote nursing only allows RNs on that program. Now, do LPNs use some of their products? Yes, but LPNs use their products when the LPN is either in the doctor's office or the doctor's office office has bought that software for their office. So what does the telehealth nurse do? If you're working in a doctor's office, or if you're working remotely for a doctor, many doctors will hire telehealth nurses for the evening and weekends when the office is closed. But there are also many that will hire you during the day. So the LPNs that are working in the doctor's office, or some of them might be working from home, but they're able to handle the daytime situations, ordering meds, that kind of stuff, appointments. So we have, with our course, we teach you almost like advice line nurse, or ask the nurse, or call the RN. And that's where usually the doctor is closed, facility is closed, and the parent or adult had a horrible headache. They're a customer or a patient of that clinic or that physician or whatever. Horrible pounding headache for X amount of hours. So they're like, let me call the doctor, because they know the doctor has on-call advice line or ask the nurse or whatever. So that you don't answer the phone. There's like a ancillary person that will answer originally with the patient. Then they go through a little bit of a process that's all computerized, and they ask the right questions. And then they determine pretty quickly, do we need a nurse on this call, or do they need one of their, maybe a supervisor, whoever, or the person is just calling for a refill. We can tell them to call Monday. So you're not actually answering the phone. There's an ancillary person that is not a nurse that's usually answering the phone. Then if the question comes to you where this person really needs a nurse, then you'll get a little text, and then there'll be like a little phone thing, and you can read what the situation is before you hit and talk to them. So with our nurses, say you're mostly peds, say you do like you're 80% a peds nurse and you're 20% med surg and primary care. So, and it's a question that not in your realm. You can push that question down to another nurse to push that question to them. They might be able to handle it better. You're going to get all kinds of questions like, I have a headache. It's pounding. What do I do? Information will come up and it'll feed you what to ask. So you'll click all these different buttons saying, okay, headache's been lasting more than 2 hours. The prompt will come up with this special technology as to some of the questions that you should answer. Being a nurse, you have a lot of leeway in how you're going to handle this. So it's not just like you have to answer this exact question. They're going to give you all these areas and different parameters. And
you choose which one.
And you kind of click. So once you start doing this job a while, you kind of know, okay, I'm going to click this one because, So anyway, you click a parameter and now it goes into another section and it tells you some questions to ask. They answer a question and then it will take another parameter and send you into another area. Maybe it'll take you totally out of the area you were in because the computer and all this medical knowledge knows that you're in another problem. So it'll bring you into another problem. So it'll let you know, do I send this person, do I call 911 and while the person is on the phone and I have my supervisor call 911, your supervisor is always there for you. There's always a supervisor. There's always another nurse. As you're talking to a patient, and if you feel comfortable with, you can hit a button and let your supervisor listen in and come into the conversation. Your supervisor can also help feed you information as to how to handle the call. So you can ask for help. So some of the doctors will have standing orders. Maybe it's an OB patient and they're calling in with certain things going on. You might be clicking some buttons and it'll come up with the standing orders that the doctor has for all their OB patients. You can also click a button.
And that's the reason that this course is for only RNs, right?
Yeah,
because of that standing order list.
Yeah. And well, it's not just the standing orders.
Okay.
I think I don't want to insult LPNs because I'm an LPN, but I think that critical thinking, even though I feel like I have some pretty good critical thinking, they feel that RNs have more critical thinking to be able to do this. I know there's a lot of LPNs that would argue this, but they feel that the RNs have more critical thinking knowledge from their training, which whatever. So I have to respect that. And that's why too. But there's also a chance that you could be answering for some kind of a clinic, a health plan, and you could be not really answering the phone, but handling with some of the triaging of the phone calls. You know, like who needs to see the doctor right away? Same thing, like they call into the office. You don't get that call, but it eventually comes to you with a message saying this person called, they're waiting for a call back, think they need X, Y, and Z. What do you think? You call them back and there's daytime protocols. There's protocols when the doctor isn't there and you're just virtual virtual and nobody's there, they're not in the
Mm-hmm.
office, then there's also a whole program that the doctor's in the office and you're giving
What they want you to
information
do.
according to that. Many times it's not going to say call on Monday or call 9.
Right.
I mean, it might say call 911, but it's going to give parameters to get the patient in right away, get the patient in the next day, send the patient to the hospital. So there's all these different programs depending on what you're answering for.
Have you seen where there's maybe more than one provider and then they have like their
loads
set
of providers,
okay.
loads.
So they have their separate, I want you to do this with my patient.
Yeah. And sometimes you're answering and there's no provider because some states have these programs where it's just ask a nurse and it's with the hospital or with the state. You don't really have a provider. It's not sponsored by a certain provider. So you're actually giving out information and helping them to find an urgent care, we'll call 911 or whatever, and also to help them find a new provider because they don't have one. And that's where ask a nurse would come in.
Would that be like insurance companies, like how the nurse triage with
a lot of them do that. Yeah.
Okay.
Yeah. And then like a perfect example is a lot of my nurses work, say Oak Street Health. Oak Street Health is owned by CVS. Oak Street Health has this amazing idea where primary care for people 62 and up. So they have facilities. I think they're in 11 or 14 states. I can't remember, but they have really nice primary care facilities for elders throughout the country. So my nurses actually answer for Oak Street Health. They have some day jobs, nights, weekends. They all are RN, and they're going to help. Like most of the time, the person already has a provider, through Oak Street Health, or they'll help them find a provider. But they're answering for loads of providers. But everything is all set up in the system. It's so organized.
I love that because you could get lost in your notes. Wait, this provider wants this one wants this. So it's kind of like
all comes up for you.
Their protocol right there for that specific provider. That's awesome. So this is all within that triage logic software.
Yeah.
Wow.
Yeah.
So that's a pretty neat software. I mean, it sounds like it has a lot.
But it's not just them that came up with the software. It's the Smith and Thompson protocols.
Gotcha. So built into
it. Yeah. So the protocols and the software that I use to teach my nurses is the most popular and most respected.
Yeah.
And there aren't many softwares. There's probably 3 or 4, and that's it for the whole country.
That's that's the neatest part about this course is that you actually give access to this software where you can go in and you can do practice where you're kind of doing
play.
Actual
they get a little play time. And then in the middle or the end of the course, they work one-to-one with our teacher, Rosa. I've got a Rose, a Rosa, and a Rosemary in all teachers. But anyway, Rosa is our triage nurse. She's an RN. She's been triage for many years. And so Rosa does a one-to-one with them and helps them go through. So we do like a couple videos on how to work the software, but they actually get to work with her. And, our software is somewhat limited because we don't have real patients in there. So we have the real software. Everything's there. Yeah. But we have to make up. We have 5 patients we made up, and then we'll have them put in that information and, help them. But we don't have real EMR set up.
That's still helpful. I'm thinking of utilization world and how they use MCG and Interqual. Even just being able to go in there and practice and see would have been helpful in the role. You know what I mean?
So you could go in. You can go in, practice. And with this course, we tell them that we'd really like for them to do the one-to-one private session with Rosa, virtually, but it's not required. It's not mandatory. So if they don't want to, they don't have to. Now, my diabetes course that I teach, the diabetes health coach, the one-to-one at the end is mandatory. And it's one of the ways they pass their test too. But with this triage, we've done a really good job of showing them by video how to work the system and how to practice. So that's why I don't require them to do the one-to-one, but most of the people do because they want that interaction with Rosa. She's really sweet.
Yeah, it makes sense because she can kind of help you to work the systems and what kind of tips she has for kind of using that system. So that makes a lot of sense. So this
yeah,
is the same system that is used if you want to work with like a company, like we said, insurance companies or doctor's offices.
practices and Oak Street
Yeah.
Health, which is CVS. Yeah.
And so you
And
can do
CVS
that.
bought Oak Street Health a while back.
Oak Street. Okay.
Oak
So
Street
then you
Health
can
is,
work with
yeah.
these companies or you can work independently
Right.
eventually.
And then
Like
like
if you wanted to
Cigna,
pair. Yeah.
Elevance Health, many times they hire like telephonic nurses or telephonic care coordinators, or it'll say telephonic triage. Cigna calls it M and then D and then live. And
Oh, wow.
it's a whole like Ask the Nurse program. I don't know why it's called MD Live, but
I would think that's for a doctor. Like,
yeah, there's even small companies that start their own triage, and they'll might work for a few doctors' offices. The thing is, though, when you start your own company, a lot of doctors now are part of big practices. So we usually say to work for the triage company that I teach with, work for them 6 months to a year, even just part-time, get your feet wet. And then they actually will help you and guide you into buying their software or renting their software services and helping you, but you got to find your own doctors. Like they might once in a while give you one if you're already established, and they'll say, Dr. So-and-so just called us recently.
So they can actually put you with providers who
but they told me they will not do that unless the nurse has tried working a little while to get their feet wet. And then they start to establish their nurse triage practice, and they have some providers and they've hired a few employees. And if things are going well, then they might pad them periodically with a company that calls that needs services.
So that's awesome. So then they can, at that point, they can partner you. If that is to happen and you're working independently, what does that look like for that nurse? Like, would they have to go and get their business license, their EIN, and
whenever you open a business, you got to go through all the they probably would want to be a LLC. So they don't want to be a sole proprietor, but LLC would be the next step above sole proprietor. And LLC is easy to start. It doesn't cost much at all. So, just your basics. The triage company would recommend a certain type of business liability insurance. If you start out with your own service like this, you might start out with 2 or 3 nurses that you hire, maybe just one nurse you hire, and then you work it too. The nurses can be 1099s. They don't have to be employees. They can be subcontractors.
Okay.
So lots of times, whoever starts their own business doing a little triage company, they usually work their butts off and they are the triage nurse. And then they start to hire a couple people.
Later.
And then, if you get bigger and more successful, then you don't have to work it anymore and you can be the boss.
Wow.
Yeah. So
that's pretty neat. Like you can start your own business and then you rent their service, and then you have your providers that you kind of work with, and then you guys work out the schedules and all that. So you can literally start your own business as an independent triage nurse. This course is amazing in the sense that you can do both working for the company, and then you can eventually, when you want, start your own company and kind of be able to set your own hours, have other nurses working with you. Thing that I've never heard of.
I know. I don't mean to burst your bubble, but I always want to tell the nurses the good and the bad. So you just said all the good stuff. The negative is many physicians are part of large practices. Many doctors are going into a practice where they're practicing with a number of doctors. You could have practices that only have 5 or they have 100. So the nurse, that's why the triage company says, they're not going to give you much help in giving you customers, giving you doctors until you've established yourself. You've shown that you're serious. You're really getting out there, getting a few customers. You've got a few employees. You're starting out because it's not as easy. Like I know you were just like all excited about it, and I want to be too, but it's not all that easy. You've got to be able to find doctors that are not attached to massive practices. Even if there is one, like a doctor's office that is attached to 20 or 25 providers, and it is a big practice, you still have a chance. But you go in and you present to your doctor, you tell them this and that and the other thing, or your friend or your connection, they now need you to go before the board of all the other doctors. Okay. You're dealing with a doctor that's one doctor practice, two doctor practice, whatever, or one here and one here. But if you're dealing with practices that are, big, that doctor can't make that decision to hire you as their triage nurse. You've got to now go before maybe one other doctor before you can go and sit, like they have their annual board meeting, but they have their meetings once a month, or then you got to go and present to the doctors. So that's what I just want to tell some nurses. They'll just think, oh, well, this doctor over here and this one there. And I'll be like, you might want to look into, are they part of a conglomerate of many doctors? Because it's going to be a little bit, but it's not impossible, but it's going to be much more difficult than if you're just hitting up doctors' offices. Yeah. So I just wanted to say that.
We appreciate that. We want to hear it all.
Yeah. Well, I want to tell people what they need to know. Like, this is great opportunity, but it's not as easy as you might think, because I don't know your area. I don't know how many doctors are still practicing independently. Also, doctors don't have to have a good triage program like this. They can just have a crappy little answering service that answers and then calls them if there's a problem, tells the person, call 911 or let me get the doctor on the phone. I'll have him call you back. There's still a lot of doctors like that. And some of them are too cheap to hire someone, or they just don't think that they need it. But the triage program and this type of service can actually bring a lot of patient satisfaction, help the doctors to keep the patients and not lose people, also help with continuity of care and catching things quickly. So when you present to a doctor, you need to be able to show them why. And the triage company that we work with, they have all those flyers and all that documentation and all the studies showing why it's worth it to hire X, Y, and Z. So it's not like you're just out there like, oh, okay, I do this. There's all kinds of science behind what you're offering and what you're trying to sell. Out of the nurses that come to my triage course, they do not start businesses. And I even try to sometimes talk some of them out of it at first, because I'm like, no, you don't know that there's a lot more to it. So go get 6 months experience just working for anybody, just to get your feet wet. You can't really go out and start your own business and sell it when you don't know what you're doing.
When you don't know. No, you would definitely, I would say even a year to 2 years of working as a triage nurse.
So some people I want to take your course and I'm going to start a business. And I'm like, no, please, slow down. I never want to, have people start something and then crash and burn. I want to help them to see them do well, but you need to know what you're getting into. So it's a great opportunity.
You have that opportunity available. I'm excited at just it being available as something that we could do, because as nurses, we sometimes feel like we're so limited. You know what I mean? And so just to hear that you can do both is just exciting.
And this is a course too that's great if somebody just wants to work part-time, because there are a lot of full-time. I put up a lot of full-time jobs, actually, telehealth nurse, but there are a lot of part-time jobs. And even I think with United Health, they have one deal where I don't know if it's 3 days a week you work in the morning, then you get the whole day off, and then you work 2 or 3 hours at night. So you might work 4 or 5 hours, and then you're off the whole rest of the day, and then you work a little bit at night. Then there's some jobs that don't start till 8, 9, 10 p.m. Some of them, they might have started 8 p.m., get off at 1 a.m. There might be some that start at 6 p.m., get off at midnight. There might be some that go the whole night. There's a lot that start at 8 in the morning and you get off at 5. Then there's some you might start at noon and get off at 4. So many opportunities, especially on weekends. Weekends, they will give you an opportunity even to just work 2-hour shifts. They'll be like, okay, they're like, we really want you to work 4-hour shifts or 6-hour shifts or 8 hours. But when they're short, and if they can piecemeal some nurses together, they'll let you work 2 3-hour shifts.
Okay. So this would be the ideal job when you want to work part-time, or you kind of need some flexibility in your schedule.
Right.
Would you say the biggest con con with maybe going the independent route would be finding the provider, or would you say there's other things to consider?
No, it's the only, like I said, it's finding when you go on your own, you want to start your own business. It's all the basics of starting a business with any business.
Okay.
Yeah. But you're going to run into this brick wall periodically, or maybe quite often, depending on where you live, if the providers are in a big conglomerate, or if they've already found a company that they really like. I mean, not everybody is even looking for triage. Maybe they already have a company. But it should be feasible if somebody really wants to do this and they've got all their eggs in the basket. They should be able to be successful, as long as they understand it's probably going to be a slow process. Like I said, sometimes you have to meet with the board. You have to meet with one doctor, and I had one nurse to go through this, and then she had to meet with another doctor, and then she met with the board, and then the board really loved her. She thought she was going to get it, and then they decided not to.
Really?
So, yeah.
Okay.
Yeah.
So you have had a nurse who taken the class and then they decided
to
want to go that route. Did she eventually get providers to work with, or
well, she was actually a nurse practitioner, and she was doing this, but she really liked talking to the patients, working with them. She had a cardiac background at the hospital, so she decided to go into functional medicine, and she has her own functional medicine practice now. If you're an entrepreneur and you have the entrepreneurial spirit, you're willing to try new things. And you're always looking to see what else is on the horizon. And I've had a number of nurse practitioners. I've had doctors take my courses. They want to learn what their nurses are supposed to be doing. Yeah. I have a doctor right now in the course. I even tell nurses, by the way, and I remind them this every once in a while, not in the triage course, but I have a doctor in a couple of other courses, and I'll be like, you never know. There's employers that take these courses, and they're in our groups too. So I have groups where the nurses chat. And like, you always want to be professional, because the employers that might hire you could very well be in the group with you right now. Sometimes they take them because they have virtual nurses that working remote, and they're not maintaining and keeping the patients. Or is
there anything else that you want to add, maybe for someone who may be interested in the independent opportunity to consider?
I can hook them up with the triage company and give them some information if they decide that. They really need to be serious, and they really need to at least get a part-time job doing triage for a little while. Then I'll spend a lot of time helping people and giving them the information, but they have to do all the legwork. I'm not going to do it for them.
No. Yeah, you got to be at least willing to do the legwork.
Sometimes, you will find a physician that don't have triage yet, or they're not happy with their triage company or their answering company. But, there is competition out there too. So when you got to be able to pound the pavement. Oh, and I've had other people try to start jobs before, and they just send emails to people, and I'm like, no, you have to get your flyers, your pamphlets, your business cards, and you've got to go, and just like the drug reps come into the doctor's offices, you've got to go and be like the drug rep. You might have to sit there a long time. You got to bring a treat for the receptionist. The keeper is the receptionist, or the person behind the desk. If you're not nice to them and you don't treat them well, you'll never see the doctor. So and
you got to know marketing a little bit.
Yeah, definitely. My chronic care manager course, we talk about the Care Simple software, which is another software. Then the CareCo software, which is all remote patient monitoring. They get to see that. I'm involved with those companies. I just have so many partners or people that have touched my life. I've touched theirs, and I bring them into my courses. Also, Prudential Insurance and some of the other really big insurances that have people on disability or job retraining pay for my course. They will pay for my course.
Nice to know.
In advance, so that nurse that's been disabled or in job retraining. My courses run anywhere from $325 to $930. If you go with the VIP package, which VIP bundle, which has all the courses, well, not all, but almost all the courses. Is that
all of them? Oh, it's not all?
No.
Okay.
The
Which
VIP bundle.
The VIP, yeah.
Everything except diabetes and triage.
Okay.
Because the VIP bundle is utilization review, and then it has the other courses, which is chronic care management, remote patient monitoring, health coaching, and HEDIS data abstraction. Or they can take courses separately.
You mentioned in another video that maybe CDI is coming along down the line.
Oh, right. Yeah. One of my nurses that's been with me a long time, she is one of the teachers for one of our courses, and she just got a job in CDI. CDI is Clinical Documentation Integrity. It's usually RNs. It has to do with making sure that the charting, all the documentation of the nurses and medical providers are accurate and up to the federal standards.
Very helpful. So again, thank you
Thank
for
you. Yeah,
taking out time to do the
thank you for
interview.
interviewing me again. I appreciate it.
Of course. You have so much good information. I just want all the nurses to know. Like, take this course, you guys. It's so loaded. I just feel like you walk away with so much. Guys, if you are interested in taking this course, check out the description. Or Marie, tell us where we can visit your website to.
Okay. Are you gonna put the Facebook group down on there at the bottom?
Yeah, I'm gonna put the Facebook group.
Okay. I have a website. It's called theworkathomenurse.com. Theworkathomenurse.com. And we have a blog there, and it talks a lot about all different types of courses that we have and different kinds of jobs that you can get as a remote nurse. And then if you need, you can find me on LinkedIn, and I am LinkedIn. I'm Marie Peppers, Marie, and then Peppers, Peppers. And I have a page on Facebook called Remote Nurse Marie. So if you just plop in Remote Nurse Marie for the under pages for Facebook, you will find me. And Instagram, I am also Remote Nurse Marie on Instagram. So that's it.
And then if you guys have questions specifically to your situation, who do we contact, Marie?
Oh, Jessica. What's up, Jessica at Gmail. And Jessica's,
what is it? Office of Jessica
at gmail.com.
And I'll put it in the description, guys. Okay.
Yeah. Yeah. So Jessica is RN. She's my assistant, and she was my charge nurse at the hospital. I'm in South Carolina. Jessica's in South Carolina. She's an RN. I'm an LPN.
I'll put Jessica's email, and I'll put her in the description of this video. She's really good with answering specific questions about these courses, guys. So check out the link, check out the email if you guys have questions. Thank you again, Marie, for doing this interview. You guys, if you like, comment, and subscribe, it really helps the following to get this message across to more nurses. So
and share.
Make sure you share with the people in your life that you think could benefit from this information. So thank you guys so much.
We cover so much.
So much. So, and the group that Marie offers on Facebook, I'm also going to put that in the description.
Yeah,
make sure you guys.
There's a private but kind of like big Facebook group that I have, and there's 64,000 nurses in there. Then I have private groups. Once you take a course and you get in the course, then there are private groups, much smaller numbers, that you can talk to our instructors and me and the other nurses in.
Nice. So you got ongoing support with every course. So
we
try to walk you through it. Yes, that's awesome. So thank you guys.
Thank you. Bye.
Bye.